Hi everyone, so today what we're going to do is administration of bladder irrigation. So first we are going to go through the equipment that we will need. A sterile irrigation solution, sterile tubing with drip chamber and clamp, an IV pole, a 3-way indwelling catheter where you have 3 ports, an indwelling catheter drainage setup, which is the bag and the tubing, alcohol swabs, a bath blanket, which can also be an inco pad, and disposable gloves. So now going on to the procedure, you would verify with your doctor's order to make sure that this patient is to have a bladder irrigation done. You will calculate your drip rate to infuse. You perform your hand hygiene. You provide privacy by closing your curtains and make sure that your patient is fully covered. You raise the bed to a comfortable working height for yourself. You will empty the catheter drainage bag and measure the amount of urine, noting the amount and characteristics of the urine. So color, odor, and amount. Assist patient to a comfortable position and expose the irrigation port on the catheter setup. Place your inco pad or your waterproof pad under the catheter and aspiration port. Prepare sterile irrigation bag for the use of directed by manufacturer. Clearly label the solution bag as bladder irrigation. Include the date, the time on the label. Secure tubing clamp and attach the sterile tubing with drip chamber to container using the aseptic technique. Right? Hang bag on IV pole at least 2.5 to 3 centimeters above the level of the patient's bladder. Release clamp and remove protective cover on end of tubing without contaminating it. Allow solution to flush tubing and remove air. Clamp tubing and replace end cover. Put on gloves. Cleanse the irrigation port with an alcohol swab. Using aseptic technique, attach irrigation tubing to irrigation port of 3-way indwelling catheter. Check the drainage tubing to make sure clamp, if present, is open. Release clamp on irrigation tubing and regulate flow at determined drip rate according to doctor's order. At times, the doctor may order the bladder irrigation to be done with a medical solution. In that case, you would use an IV pump. Remove gloves. So because the irrigation is currently running, we would leave the inco pad in situ in case of leakage. Assist the patient to a comfortable position. Cover the patient with bed linen. Place the bed in the lowest position. Perform hand hygiene. Assist patient's response to procedure and quality and amount of drainage. As irrigation fluid container nears empty, do not allow drip chamber to empty. So if you notice that the bag is coming to an end, you do not allow the drip chamber to empty. So you will close the chamber. Disconnect empty bag and attach a new full irrigation solution bag. Continue as ordered by doctor. You will then record the amount of irrigation input and output in your fluid balance chart. And that is the end of bladder irrigation.